Hi, my name is CJ Curran, and I'm going to be doing a demonstration of traction for muscle spasms of the paraspinals on the upper lumbar region. The patient is a 25-year-old male with muscle spasm of the paraspinals at the upper lumbar region. The patient is presented with palpable tightness and pain of the paraspinals in the lower back. Diagnostic testing demonstrated that there is limited active range of motion in lumbar flexion, as well as decreased strength with manual muscle testing for lumbar extension. The contraindications and precautions for traction of the lumbar spine include situations where motion is contraindicated, any acute injury or inflammation, hypermobile joints and instability, peripheralization of symptoms with traction, and uncontrolled hypertension. Some of the precautions for traction of the lumbar spine include structural spinal diseases, conditions where the belt and pressure can be hazardous, displaced disc protrusions, any situation where the severity of the pain is fully resolved with traction, claustrophobia, inability of the patient to tolerate supine or prone positions, and disorientation. The patient positioning for this situation is supine with legs on a traction stool in order to target the upper lumbar vertebrae. The treatment parameters for soft tissue elongation for muscle spasm are force applied at 25% of the patient's body weight, a hold and relax time at 5 seconds on, 5 seconds off, and a total treatment time of 20 to 30 minutes. The expected outcomes for this modality include decreased symptoms of pain as well as muscle tightness, leading to increases in strength and range of motion. After all precautions and contraindications have been cleared with the patient and the benefits as well as the process of treatment has been explained, the setup for lumbar traction can begin. And for this machine, there's two separate belts that go, and the first one is a lumbar belt, and that's applied first, and the second one is a thoracic belt, which is kind of overlapped on top of the lumbar belt. The first step is setting up while the patient's standing, making sure it's tight enough but not uncomfortable, and then any adjustments can be made once the patient is lying supine. Before we start treatment and lay the patient down, we want to make sure that these silver clamps are facing on the front side of the patient at both the lumbar belt and the thoracic belt. Now that we're ready for treatment, we've made sure that the patient's thoracic belt has been fastened securely to the head of the table and that his lumbar belt has been fastened securely to the traction machine. The patient has been placed in a supine position with his feet resting comfortably on the traction stool, and we've made sure that the traction table, the sliding aspect of the traction table, has been unlocked. Right before we begin treatment, we're going to double check one more time and make sure that the patient's thoracic and lumbar straps are nice and secure, and we're going to give the patient an emergency off switch in case he feels any kind of discomfort or pain during the treatment. And now that we're about to begin treatment, we're going to set up the parameters on the traction machine. And again, this treatment is for elongation of the soft tissue to treat muscle spasm. And we're going to set the pounds of traction at 43 pounds, which is around 25% of the patient's body weight. It's going to be intermittent traction, and it's going to be set at a 5-second hold time and a 5-second rest time. And the total treatment time is going to be around 20 minutes. And so we can set that up now and begin treatment. During the course of the treatment, I'm going to be present with the patient and checking up on him every 5 minutes to make sure there's no signs of discomfort or pain. Thank you for taking the time to watch this video.